Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for BC for Thursday, and I wanted to acknowledge that we're on the territory of the Lekwungen-speaking people, of the Songhees, and the Esquimalt First Nations. Tomorrow, Friday, we'll be releasing a written report at around 3 o'clock. The next in-person briefing will be next Monday, and it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. For today's update, we have a total of 30 new cases in British Columbia, 29 who tested positive and one epidemiologically linked case, giving us a total of 3,392 people with COVID-19 in British Columbia. That includes 1,051 people in the Vancouver Coastal Health Region, 1,750 in the Fraser Health Region, 142 people on Vancouver Island Health, 315 people in the Interior Health Region, 77 in the Northern Health Region, and 57 people who reside outside of Canada. We have now 304 active cases in the province in all health authorities, 16 of whom are people in hospital, 3 of whom are in ICU or critical care. We have 2,898 people who are fully recovered, and unfortunately we've had one additional death in the last 24 hours in a person in long-term care, bringing our total number of people who have died from COVID-19 to 190, and our condolences go out to the family and the community of this person. We have no new healthcare facility outbreaks, and we continue to have outbreak in 1 long-term care facility and 2 acute care facilities. We do continue to have exposure events that we are monitoring across the province, many of them in the Interior Health Region, in the Central and South Okanagan, where a number of events happened over the past couple of weeks that have led to a surge in cases in those areas, some of whom are people who have returned to other parts of British Columbia. As we know, this virus can be a stealth virus. We have seen it move around our province, sometimes silently, with far-reaching impacts and serious consequences. Inside or outside, visiting a friend or out for dinner, being around crowds of people, especially people you don't know, puts you and your family and your friends at risk. Instead, for you and those you care for to stay safe, we need you to keep your groups small. Only spend time with those that you are closest to, those you know, and use your layers of protection when you're around others. Our restaurants have a requirement of no more than 6 people per table. That is a manageable group that reduces risks. You can use this number as your guidance for other social activities, whether it's a small group going to the beach, whether you're going to a park, whether you're going to have a get-together at a friend's place. Keep your groups small. That is what is going to prevent transmission to more of us in our communities right now. If you're going into a small store or taking transit where it is difficult to maintain our safe distances, then wear a mask. That's part of our layers of protection for ourselves and for each other. You can protect your household bubble, your family, your close friends, by being mindful of those around you and giving each of us the space to stay safe. Everyone deserves to have a fun summer, and I think we need it here in BC and across the world with what we've been dealing with for the last few months. But it needs to be a safe summer as well. Today, we know that over 1,000 people in every health authority across our province are self-isolating because they have been exposed to COVID-19. Some of those people will develop this virus and this illness in the coming weeks. And they've exposed, a good proportion of those people were exposed at parties and events that have happened over the last few weeks in the central Okanagan, particularly in and around Kelowna. These British Columbians, these people in BC, have had to close their businesses or miss work, isolate from their family and friends, and not leave their home unless it's to get medical care. That is the impact that this is having on our friends and our families in this province right now. It shows us that the actions of a few, even if inadvertent, can cause a tremendous impact. We are in the process of introducing an order. I will be introducing an order requiring those who rent properties, whether it's boats, rooms, Airbnb, houseboats, or houses, to limit the numbers of guests and visitors to those premises as part of those rental agreements. That order will apply across the province because we know that this is not just an issue in the Okanagan. This is an issue that has affected vacation and rental places across BC. This will be another step in ensuring that we have those provisions in place that reduce the numbers of people who are gathering and the risk to all of us when this virus is transmitted. Yet we can take confidence in knowing here in BC that we know what we need to do to turn this surge around and to get our curve back down. I encourage everyone to be the voice of compassion and reason and to call out your friends if they're not feeling well and they want to go out with you, or if they're supposed to be staying home and isolating. Support them in doing that so that we can stop this transmission, stop these chains, and get back to our summer and our fun. To show those around you you care, have safe social interactions with fewer faces and larger spaces. Let's flatten our curve once again, and let's all do our part by being kind and being calm and being safe.
Thank you very much, Dr. Henry, and on behalf of the Premier, and I know everyone watching us now, I wanted to express my condolences to the family and friends of the person who passed away from COVID-19 in the Vancouver Coastal Health Authority in long-term care since yesterday. This is obviously a very difficult thing and a very difficult time for our entire province, but people who are dealing with their own grief at the loss of a loved one, particularly as a result of this pandemic, but for really any reason, because everything from one public health emergency to the other public health emergency, the overdose crisis, is related in some ways right now to these circumstances. We want to pass on all our condolences to this family. We know what we want you to know. I know Dr. Henry, I know Premier Horgan, I know I speak for myself, of course, as well. I want to pass on those condolences, the understanding of the grief involved, the hope that people can find peace in this very difficult time, and we are with you at this time in particular. That's true of the 189 other people previously, family members of people who passed away from COVID-19 in BC. As you know, we have 30 more cases today, including significant new case numbers in the Northern Health Authority. What it reminds us of is the absolute need not to go on vacation sick, not to go to work sick, not to go to school sick, to stay at home, to ensure that you do not transmit COVID-19 and that you do not make any decision that would put people, particularly the people you love, at risk. We have 16 people currently in hospital with COVID-19. That's 7 in Fraser Health, 2 in Interior Health, 6 in Vancouver Coastal Health. One of the individuals is defined as out of Canada. So that's 16 people. That's down 1 from yesterday, and the same number of people in critical care. Every Thursday I provide an update on surgery renewal in our province and on our long-term care visitation update. So I'm going to do that now. On Tuesday, as you know, we provided our first monthly update that we will be doing monthly with Michael Marchbank, who presented that to all of you, and the progress we've made in fulfilling our surgical renewal commitment. 52% of the postponed surgeries have now been completed, those postponed during the COVID-19 surgery delays. 100% or more of 2009 surgery volumes have been completed each week since June 15th. Surgical activity will increase. There will be a reduction in the summer slowdown of 52% over what occurred last summer. 29 new anesthetists have been hired, and we have 760 new graduate registered nurses. And recruitment efforts have also seen the hiring of 111 perioperative registered nurses, 6 perioperative licensed practical nurses, 60 post-anesthetic recovery registered nurses, and 35 medical device reprocessing technicians. I'm repeating some of these achievements because in a week where we've had some difficult news in our BC COVID-19 effort, seeing the progress we've made, the extraordinary progress we've made that everybody should see themselves in because everybody is part of it. This effort to ensure people get the surgeries we need, I think, is inspirational. And the commitment that made these achievements possible should inspire us, each of us, in our ongoing commitment to stop the spread. And with that, here's our 12th weekly update on the surgical renewal commitment. 53,977 surgeries have been completed since surgeries resumed on May 18th. Of those 53,977 surgeries, 41,456 were scheduled surgeries, 12,521 were unscheduled or emergency surgeries. That's 10,025 in Interior Health, 15,109 from May 18th to July 19th in Fraser Health, 12,376 in Vancouver Coastal Health, 11,229 in Vancouver Island Health, 3,011 in Northern Health, and 2,227 in the Provincial Health Services Authority. Last week, the week ending July the 12th, we performed 6,506 surgeries. We had reported, as you know, last week 6,322 completions, but health authorities have restated that week's volumes, which led to an additional 184 completions being reported between July 6th and 12th. This week, the week leading up to July 19th, we are reporting 6,496 surgeries were completed. As of this week, even more people have been contacted. We have now contacted 66,651 patients to discuss rescheduling their surgeries, which is an increase of 3,865 from last week. I want to express my gratitude to everyone doing this work and to all of you. This is inspirational. This is our surgical renewal in BC after a very difficult 2 months. And everybody, from surgeons to nurses to medical office administrators to health sciences professionals to all of you who have been part of it, should feel pride in this extraordinary effort that has brought care to thousands and now tens of thousands of people who had seen their surgeries delayed. On June 30th, we announced the easing of restrictions for visitors at long-term care facilities and seniors assisted living residences. We recognized then the hardship of being apart from loved ones for these many weeks and how we are looking forward to seeing them again. Each health authority has been actively working on their plans to safely allow visitors at their long-term care and assisted living facilities. Each week I report on the number of facilities that have a written safety plan in place and have started to receive visitors. We have 584 long-term care and assisted living facilities across BC. This week, there are currently 465 facilities with safety plans in place. That's 79%, an increase of 147 from last week's 318. That's 95 in Vancouver Coastal Health, 96 in Fraser Health, 109 on Vancouver Island, 132 in Interior Health, and 33 in Northern Health. I will report next Thursday on more ongoing progress, but I think it's fair to say a majority of people in BC long-term care homes have now received visits, and we are delighted by that, and again, recognize the link between that progress and the work that everybody has done in our province. In closing, the past 2 weeks have delivered some hard lessons for us in COVID math, and we've seen an increase in the number of cases. Yesterday, we announced that BC's contract tracers had announced more than 1,000 people across the province in every health region who have come into contact with COVID-19 trails and must now self-isolate at home. We know that our efforts in March and April and May and June that each of us made bent the curve, flattened the curve. But July reminds us that we all need to keep working individually and collectively. We have the responsibility to use the skills that Dr. Henry and public health officials have taught us, no matter where we are in BC, no matter what we're doing. This is a summer of renewal. We see that in the reports I presented to you today. This is a source of optimism because it shows what we can do together. But right now is the time to renew our commitment to stop the spread. It all depends on us. Our visits to long-term care, school for children, surgeries for patients, our economy, our health, our safety, our family, our friends, our loved ones. We are counting on one another. It depends on us stopping the spread right now. And we have to continue to join or rejoin the fight to do so. Aujourd'hui, nous annonçons 30 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 392 cas en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 dans la régie de santé de Vancouver Coastal pour un total de 190 décès en Colombie-Britannique. Nous offrons nos condoléances à cette famille, premièrement, et à tous ceux qui ont perdu leurs proches pendant cette pandémie. Il y a aussi 16 personnes actuellement hospitalisées en Colombie-Britannique à cause de COVID-19. Il y a, finalement, je veux dire qu'à ce jour, 2898 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Thank you very much. Merci beaucoup. I have, I think we were saying I have estimates restarting at 1:30, and Dr. Henry has some responsibilities there, so we may take a few fewer questions than usual, and I apologize for that, but we're happy to take your questions.
Thank you, Minister. As he mentioned, we will be limiting the questions this afternoon. Please, as a reminder to everybody on the phone, enter *1 to enter the queue. If you've already pressed *1, please do it again to ensure I see your name. You are limited to one question and one follow-up only. Please also unmute your phones. You will not be audible until I call your name. First question is from Richard Zussman, Global News.
Considering the amount of time you have, Dr. Henry, one of the issues Premier Horgan was asked today was about a fall election. Do you believe it could be safe in British Columbia to have an election in the fall in the midst of a pandemic if there is or isn't a second wave?
So this is a question that we've been in touch with the Chief Electoral Office on since the very beginning of this. As you may remember, back in March, there were some by-elections that had been scheduled to happen. And so my office has been working with them since that time to make sure that if we do have elections, that we can do them in a safe way. We did recommend at that time postponing the by-elections, given the uncertainty that we were dealing with. But we have an ongoing relationship and have been developing plans so that we know that we have a minority government, both here in BC and federally, as well as a number of by-elections and other municipal elections that are scheduled in the coming months. So yes, we are working with them so that we are prepared as a province for whatever comes up, whether it be the fall, next spring, next year, and that elections can happen safely.
Do you have a follow-up, Richard?
I do. Can you explain to me what these new orders will require for houseboats and other rentals in terms of the specifics of what people will and will not be allowed to do when they rent? And will the onus fall upon the person doing the renting, in some cases they live a far way away from where that property is, so it's hard to enforce. Will the onus fall on them to ensure that the rules are followed?
Yes, as with most of our orders, the onus falls on the owner-operators to ensure that the restrictions are being followed, and we can support that with local bylaw enforcement and public health enforcement as well. So we are working out the specifics. It will be available within the next day, but we are looking at restricting, building into rental agreements and ensuring that these are adhered to in all vacation properties, rental properties, resorts. We've seen the challenge is that people get together and then they have parties and they invite people over. So it will be restrictions on the numbers of people based on the size of the houseboat or the boat or the room, but also restrictions on visitors to those that will be in those rental properties as well. The exact numbers we're still working out, and we have reached out to make sure that we can do it in a way that is manageable. As we've done with all of these, we've consulted with those who know the industry best to make sure that we have reasonable and practical enforceable bylaws. So those will be coming, the details will be coming very soon.
Next question is from David Molko, CTV.
Hi, Dr. Henry. You've been widely praised for your leadership style, your tone, your approach, be kind, be calm, be safe. When we go back and look at that drum circle about the events in Kelowna that sort of have led us here over the past couple of weeks, why do you think the message isn't getting through or perhaps not being taken seriously enough? And do you think there's maybe another more firm way you could put it?
Yeah, we have always relied on people's best judgment and best sense. I think all of us felt a bit of relief as we were moving through this, and particularly younger people who have been differentially affected by things like job losses and school closures. And there was perhaps a sense that they were being differentially negatively impacted and not being impacted by COVID so much, so they could get out and do this. And I think as well, when we travel and we've moved around BC, we bring our risk with us, and people coming from other places bring their risk as well. And perhaps this is a wake-up call to us that we cannot lose those important things that have kept us safe thus far. And so, yes, we are tweaking the guidance that we have, the orders around restaurants and pubs and those events where we know that these are risky situations, to try and ensure that we can keep things open and allow people to have those opportunities to get together and socialize. We know how important that is, but we cannot lose sight of the fact that if we let our guard down and we have too many people in those places, then it can get away from us. And we are now, there's over 1,000 people that have been impacted by this in the last few weeks. We need to get that down again so that we can all enjoy the rest of this summer and prepare ourselves and be able to do what we need to do going into the fall.
Do you have a follow-up, David?
Yeah, and for both you and the Minister, Dr. Henry, British Columbians obviously bought in big time in the spring. The serology study results showed that. Do you think they're still buying in? I guess in your heart of hearts, how would you explain your biggest worry right now, given what we've seen in the last couple of weeks?
I actually have been incredibly heartened by how people have been buying in and continue to do the things that we need them to do. We see groups, and we've said this all along, there's been groups that have been quite visible because they're outdoors, and the drum circle is one. But people, even within that scenario, were doing their best to keep their distance. They weren't engaging necessarily. Most people that I saw from the videos weren't, speaking really closely to each other. There was not a lot of sort of gathering in those situations which are riskier. Not to say that we condone this, because we don't. We need to be careful. And, we'll be working in many different scenarios to make sure that we can encourage and educate and do compliance checks in a way that support people to do the right thing. But I do still believe, and I see it every single day in the decisions that are being made by young people that I'm involved with in my life and by others around the province, that if we tell people what we need them to do, we reinforce it when we see things like this, and we give people the means to do that, that the vast majority of people do this. And right now we have to support each other to continue to keep our numbers and groups of people that we're with small. And if we are exposed, if we are ill, to get out of there and get tested, and we can support each other to stay home and stay away from others.
I think we have to put it all into context. I'm concerned. I think Dr. Henry's concerned, no matter how many cases they are, because it shows that COVID-19 is still here. You've seen an increase in cases pretty much 2 weeks ago, 10 cases a week, or 11, and now 20, and now 30. We do have to put it in context. We're operating. British Columbia lives in a sea of COVID-19. If you look at the case numbers in Washington State or in Alberta, they would be, I would say, not happy, but probably pretty happy to have the case numbers we've had here. In addition, we now have in long-term care one active outbreak, a very serious one at Holy Family, which is heart-wrenching for all of us that are involved in this issue. But nonetheless, one active outbreak when you compare that in long-term care compared to where we were a month or 2 months ago. So we've reopened a lot of things. We're doing surgeries. We're having visits in long-term care. All of these are extraordinary successes that are the result of actions of people in BC. And I just think we have to recommit ourselves to this because the virus isn't going away. It doesn't argue with us. It does what it does. And we have to respond to that by recommitting to physical distancing, by recommitting to washing our hands, by recommitting absolutely to staying home when we're sick. And if we do all these things, we can together flatten the curve and have at the same time a new normal, a different summer, but a great summer together. So I think that this is going to be a challenge for months and months and months to come. And we've got to act in such a way that we understand that. And as Dr. Henry repeatedly says, I think we have to be kind to one another. Often when we see events, and I can recall shots of people on beaches and pictures, I should say, on social media, people on beaches in the month of March, and concerns about ferry terminals in the month of April, and now we hear about other outdoor events, and we see them because they're visible. But I think overwhelmingly, people are following the council. That's what our surveys show. That's what's occurring, and that's what's reflected in the evidence. But we're seeing an uptick in cases, and we got to recommit ourselves to that now in a fundamental way. We're going to deal with this for months. We got to recommit ourselves to the guidance that Dr. Henry and other public health officials are providing us.
Next question is from Marcella Bernardo, News 1130.
Hi, everyone. Thank you again. I'll try to be quick because I'm going to circle back to the question I asked you, Minister Dix, yesterday about what's happening to ensure all health authorities still have greeters at entrances to make sure that visitors who are coming in are allowed to be there and they're not bringing the virus back into acute care facilities, because I've heard from several people working at hospitals now that there are no longer greeters at the entrances telling people that they need to explain why they're there.
Well, Marcella, I think it's what I told you yesterday, that the rules for visitors and essential visitors haven't changed. There are essential visitors in our acute care hospitals that meet the criteria of essential visits, and they were adjusted in May to address the concerns of people with disabilities. And certainly, if people have concerns about acute care hospitals or about the way in which that's being controlled in acute care hospitals, I'm happy to hear those concerns. But those rules haven't changed. The rules around visitors in acute care haven't changed. We are looking at those rules into the future in two areas, and I talked about this yesterday. One, what we call alternative level of care patients, people who are there who are, at least in part, in some hospitals, particularly in some parts of the province, as sort of an extension of long-term care or waiting for long-term care. And so effectively their circumstances are similar to that of people living in long-term care. And the other is for children. But otherwise, if there are specific concerns about specific hospitals, we can address that. But the rules around visitations in acute care hospitals stand, and obviously as a result of your question yesterday and now today, we're looking into that, and we'll be communicating the message that the rules around visits in acute care continue to stay as they were last month and the month before that.
Do you have a follow-up, Marcella?
Just quickly, how close are you to sending people onto beaches with bullhorns to remind them to stay at least 2 meters apart?
That's never been my style, so not close at all. I will say that municipalities, local health authorities are working. Park boards, in the case of Vancouver, are looking at how we can make it easier for people to do what we need them to do. And that's the way we've always done things: is making the right decision, the easiest decision to make. So we're looking at how we can do that around the province and support people being able to safely go to beaches and parks and other outdoor spaces in small numbers and facilitate that.
Next question is from Tanya Fletcher, CBC.
Henry, your new order blankets rentals province-wide. Are you still considering regional specific rules like you'd mentioned possibly yesterday for the Okanagan? And if our pandemic is more kind of regional in a sense in our results going forward, is geography likely to drive future decisions?
Yeah, the short answer is no. I did muse about that a little bit yesterday, but on further discussions with my public health colleagues around the province, it really became clear that this was not just a local issue, and that the issues of large numbers of people going to Airbnb or houseboats or rental properties or resorts was something that we were seeing across the province to varying degrees, and it was highlighted by the fact that we've had transmission in events related to Kelowna in particular. But those have affected people across the province. In every health authority, there are people that have been exposed because of events that happened in one area of the province. So we are going to continue with our provincial approach. It's become very clear that this is not just a local issue and that it's not geography that's the issue. It's the settings that are happening, and they may, there's people that have dodged the bullet, if you will, in other areas where similar parties happened or similar events happened. So it was pointed out, and I absolutely agree that this is something that is an important issue across the province.
Do you have a follow-up, Tanya?
I do. This is from Minister Dix. A BC doctor is heading to court to demand mandatory mask rules. I'm wondering if you can respond to the application. It was filed in BC Supreme Court this morning, and it calls for an injunction requiring a mandatory mask policy in indoor public spaces. And if you could answer in French as well, please. Thanks.
Yeah, I'll take that to start with, because that is sort of in my purview. And that is something that we have talked about quite a bit. There is no, it is not my expectation that we will require mandatory masking in indoor spaces. We know that it is an additional layer on top of the other layers that we use to keep each other safe. And it is the least effective of the many layers that we have. We also know that there are reasons why some people cannot effectively wear masks, and we need to be able to accommodate them without stigmatizing people. Having said that, we also look at the data around the world and where these are most effective. And we do not have a lot of community spread. We know exactly, we know fairly well the types of situations where we are seeing spread of this virus in our communities. So right now, I do not believe that there's sufficient community spread that we are at that point where mandatory masking, which is a rather heavy-handed approach, is needed. We do absolutely and will continue to encourage and recommend strongly that people in areas where you cannot maintain that safe physical distance for a period of time, so we're talking particularly transit, but smaller stores where barriers may not be in place, things like that, that you absolutely should wear a mask. And it's to protect you and to protect your neighbor when we're all doing it. And we do it as a matter of courtesy and respect for our community. And I have seen many more people wearing masks, and that's very gratifying. I do it myself. If and when we get to a point where we have a lot of community transmission, where we're seeing a lot of these transmission events happening in places like transit or in places like retail stores, then this is an option that we can move to. But it is not something that I'm considering at this point.
Well, I think what BC has really been recognized for in our response to COVID-19 is following the advice of public health experts, and of which Dr. Henry is the provincial health officer, but we have outstanding experts around the province, and we follow the advice with rigor. In the case of masks, for example, like Dr. Henry, when I go to grocery stores and when I go on transit, I wear a mask, and I would encourage people to do so in those circumstances. It's the view of public health, based on the evidence, that a mandate is not desirable at this time, and that's the decision that should be properly in the hands of public health. But it does remind us of one other thing, that Dr. Henry talks about a hierarchy of ways we can stop transmission. At the top of that hierarchy is physical distancing. And wearing a mask does not take away the obligation to physical distance. It does not take away the obligation to make the next level of the hierarchy, which is to take measures to stop transmission, things like plexiglass shields at grocery stores that we've seen everywhere, or other rules that limit gatherings of people and the numbers of people gathering together. And wearing masks is of value, but it is on the hierarchy that has been described repeatedly by public health at the bottom of that list. And I think some people may believe that by wearing a mask we can avoid all these other things, and in fact that is not the case. The other things are absolutely essential. With respect to any court case, obviously I'm not going to comment on that. Obviously, I think that decisions, public health decisions about what the best course should be supported by the government, but presented and based on evidence, and that's what we're doing in BC, and that's what we've done from the very beginning. En français, c'est bien. En français, juste pour dire que j'ai pas vraiment de commentaires sur la question de l'appel aux tribunaux de ce docteur. J'ai pas, il faut dire, entendu parler jusqu'à maintenant. J'étais dans un débat parlementaire ce matin. Mais cela étant, et c'est important de porter une masque, je pense, que quand on est à une épicerie, par exemple, ou sur un autobus, c'est ce que je fais. Un mandat, une loi, à notre sens, n'est pas nécessaire à l'heure actuelle. Et ces décisions sont guidées par nos leaders extraordinaires, tels Dr. Henry, dans le domaine de la santé publique. Et on va suivre les conseils là-dessus. Et je pense que ça, c'est la venue appropriée pour faire ces décisions, et pas devant les tribunaux. Mais c'est le droit à tout le monde de faire appel aux tribunaux. Et bien entendu, j'ai beaucoup de respect pour cela.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Glenn Korstrom, Business in Vancouver.
Hi, it's for Minister Dix, and actually it's a couple things because I've been following your statements about the visits, and today you're saying that there's 584 homes, whereas on June 30th you were saying there were 681 homes. So first of all, just a clarity on why that new number.
Hey, Glenn, happy to get you the numbers on these questions. This is what we're defining here are long-term care and assisted living homes or other homes in the province. And the number that I presented to you, or the number of homes who require plans for visits, is 584. Let me just get the right numbers in front of me. So in terms of where we are, it's underneath here. And of that, we have 465 facilities with safety plans in place, and that number is 79%. But I can get you some details on the numbers if you like.
Do you have a follow-up, Glenn?
Yes, it was on the funding, $165 million, to hire up to 3 full-time staff for each one of the homes. And it sounded like an ambitious thing to be hiring very quickly, but I'm wondering, how is the hiring done so that staff time isn't taken away from doing other things in those homes to help train visitors on how to wear equipment and to guide them to a neutral area?
Well, we're going to have more to say about some of the details around hiring and training that were taking place in the coming weeks, but I think you raised an important question. It's important to, and we've done this, I believe there's close to 2,000 new healthcare assistants across BC since the beginning of the COVID-19 outbreak. We've had a significant increase in the number of registered nurses and of doctors who've returned to the profession. So the task will be to ensure the training of people and to ensure that they're hired. But we think these things are necessary, that we need to make some fundamental changes in long-term care to allow for visits, but to ensure that the staffing needs of visits are adequately addressed. Before this, if you know this, because I visit long-term care homes regularly, both as Minister of Health, as an MLA, and for family reasons, I can tell you that the amount of staff time devoted to visits tended to be zero. People would have a fairly free run under most circumstances, and indeed, often visitors added to the work and to the esprit decor of the whole care home, especially when care homes are working very well. And obviously, when you add these kind of provisions and these kind of safety guidelines, it requires more resources, and that's why we've made those resources available to care homes across BC. Merci beaucoup. Thank you very much. I'm happy. We'll see you Monday.